this final section of the module, we're going to talk about an unacknowledged problem, which is abuse of caregivers, when the elder who's being taken care of is abusive towards their caregiver. When do older adults become abusers to their caregivers? Well, some of the situations that we're talking about here are quite similar to abusive situations where it's the caregiver that's the abuser. Mental illness and substance abuse by the elder can cause them to be abusive. Dementia, especially in the sort of middle stages where the person's behavior becomes bizarre. If a person has dementia, it's very frightening to them, and sometimes people lash out when they're frightened. They may not recognize the caregiver and start to hit them or accuse them of being an intruder in the house. When the elder is a man with female caregivers, we talked about the role of sexism, especially a man with dementia no longer has the inhibitions, no longer remembers, oh, I'm not supposed to say these inappropriate things to women. They see a young woman and they'll say whatever comes to mind, and sexist attitudes can emerge. If there's a history of abuse in the relationship, that abuse is going to continue, like we talked about with the caregiver against the elder. If the elder has bigoted attitudes toward caregivers, very often they will, especially if they have dementia, but sometimes even if they don't, they will say racist and sexist, inappropriate things to their caregivers. And sometimes it can be a family member that's abusive towards a paid caregiver, right? That the family member who has problems, whether it be substance abuse, whether it be mental illness, whether it be anger management, whether it be bigotry, will be abusive towards a home health aide or staff in a nursing home. So what is the impact of abuse on caregivers? Not surprisingly, it increases their burden terribly. If they're paid caregivers, incredible job stress and feeling burnt out, not able to handle it anymore. Of course, the trauma of listening to racist remarks, sexist remarks, insults. They could be physically injured and not want to fight back, afraid to hurt the elder, but also fear of job loss or fear of retaliation, right? If I complain, I'm gonna be the one who loses a job. And so just like an elder who is dependent on their caregiver doesn't want to complain about the caregiver, sometimes a home health aide doesn't want to complain about an abusive family because they need the job. Or they're afraid that the agency will take the word of the family or the elder over their word. So again, if you come across situations like this, what are some intervention strategies to make the situation better? Well, unfortunately, it's hard to change the behavior of a demented person or a person with racist and sexist attitudes. So the person needs training and education on how to handle abusive patients. And that training isn't just about how to sort of brush it off, but rather truly how to handle it, how to be firm while still being an appropriate caregiver, but how to firmly set boundaries and let everyone know that you're not going to take abusive behavior. However, if the client has dementia, they truly cannot change their behavior. Firm boundaries are not going to help. And therefore, they need training and education about dementia and about ways to handle this kind of behavior in the elder. There needs to be intervention with the family members, getting the family members on board to support the caregiver. And if it's the family members who are being abusive, then the agency needs to step in and say, you can't treat our staff this way, or you're going to be without caregivers for your older adult. Setting firm but gentle boundaries. I'm not going to take this kind of talk from you. I'm not going to take this kind of treatment from you without hitting back, without yelling back, but being firm about how you expect to be treated as someone who's taking care of this person. If the person has dementia, redirecting them, right? So stepping away, diffusing a situation where they're combative, redirecting them if they're saying inappropriate things. And if necessary, report the abuse, get help, leave the dangerous situation. So whether it's reporting the abuse to your employer, if you're an agency employee or nursing home employee, but getting help and not staying in a dangerous or an untenable situation.